Anthony Albanese, thanks for being with us.
Good evening, Lee.
What should be happening around the country now to ensure that if there are more coronavirus spikes, we don't see these kinds of aged care deaths and cases replicated?
Well, it shouldn't have taken to this week to set up an aged care national advisory body that was established only after the National Cabinet met last Friday. This is a government playing catch-up. This is a government that should be listening to the comments of the Aged Care Royal Commission. It should also be listening to the health experts and learning from the experience. The alarm bells have been going off, Lee, but no one has been listening.
But I think for Australians around the country, what they want to know right now, regardless of where they are, is if their mum and dad's in a facility and there's an outbreak in their state, that we're not going to see the same thing happen. So again, what do you think should actually happen right now to protect those people?
Well, there's a range of measures that are necessary. One of the things that is necessary is to make sure that the workforce is fit for purpose. Quite clearly, there have been major problems in aged care for a long period of time. They were identified by the Interim Royal Commission report of last year that was titled Neglect. That was the hint of how big the problems were. Then, of course, we know from international experience that the alarm bells should have been going off, saying that aged care was a particular issue because it was older people who were vulnerable to this disease. And then we had, of course, Dorothy Henderson Lodge in March, Newmarch House in April, reports there that went to the government that weren't made public, but that warned very clearly of what was necessary. Putting in place workforce numbers, putting in place protective equipment that wasn't available appropriately for nurses and other carers. We need to make sure that there's transparency in the system, Lee. And when I've met with both workers and with relatives of aged care residents, they've been concerned that issues such as when there's an inspection at these facilities, they're often given notice in advance so they're able to tidy things up.
You seemed keen in your first answer to blame aged care failures all on Scott Morrison, but aged care deaths wouldn't have occurred in Victoria without community transmission or quarantine failure. And as the Victorian Premier has himself said, that buck stops with him. Wouldn't it be more honest of you to direct some of your anger as well towards the Victorian Labor Premier?
Well, let's be very clear, Lee. The Prime Minister stood in the courtyard on a Thursday after Parliament got up and waved around the rules for dealing with these issues, and aged care is clearly a federal responsibility.
But it's a shared responsibility because, as I pointed out, there's community transmission, there's quarantine failures that allowed coronavirus into aged care facilities.
Lee, aged care is both funded and regulated by the federal government. And if you look at the facilities that are actually run by the Victorian government, that are run by Daniel Andrews as Premier, they haven't had any issues.
On the subject of border closures, what is the logic of states with zero cases having their borders closed to each other, given the social and economic harm that's being done?
Well, you look at the decision of the federal court today, Lee, which found that the WA government did do the right thing, basically. It was found that it was effective in them closing the borders. It found, of course, that because the Commonwealth had made a submission in support of Clive Palmer's challenge to that border closure, that had to be taken into account, that couldn't just be erased, and the High Court would determine that. But we know that it's been effective. And what I haven't done, Lee, is second-guess state governments, whether they be the Labor governments of Queensland and Western Australia that have had border closures, or the Liberal governments of Tasmania, South Australia,
sure,
and of course Gladys Berejiklian changed the borders between New South Wales and Victoria as well.
But you're an influential politician. You'd like to be the Prime Minister if you had the opportunity. So I'm asking, what is the logic and how long should it go on that states with zero cases just keep their borders closed to each other?
Well, I'm not a member of the National Cabinet, Lee, and one of the things that is very clear is that the National Cabinet now has been reduced to state premiers and chief ministers telling each other what they're doing.
But what's your opinion? I'm
and
asking
then-
you now, what do you think they should do?
And then going their own way. I think they should take the advice of their respective chief medical officers, but I also think that the National Cabinet, if it was something other than a title, should be playing a role in working these issues through. I'm not around that table, Lee. That's a decision that Scott Morrison made, and that's up to him.
Qantas is cutting another 2,500 jobs today. So many Australians have also taken pay cuts during this period as well. Would Australians be mugs to imagine that at the end of this, that employers are going to go, OK, everybody, we're reinstating your full pay and we're giving you your old jobs back?
Well, it's unfortunate that some employers will take opportunities to attack wages and conditions.
Do you think that's what some people are doing here?
Well, I'm concerned that that's the case, and I know that the union movement's concerned that that's the case as well.
Is it the case with Qantas?
Well, I think it's of great concern that Qantas have had support of JobKeeper for these employees for a considerable period of time, so they've had the subsidies for those wages. But today I think it is very regrettable that they've announced these changes, which amounts to contracting out of work that's been done by a group of workers effectively for a long period of time.
Anthony Albanese, thank you very much.
Thanks, Lee.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.